Most of the time with breast care, with breast cancer care, the first person that a patient sees is the surgeon. So we not only act as the first person to educate the patient about what their diagnosis means and what potential treatments might be coming down the road, we also sort of act as a coordinator of their care. So I reach out to the other specialists that are needed for the patient and help to coordinate that with the patient. Sometimes we do chemotherapy first, and it's very important for a surgeon to recognize when a woman has a large tumor that might benefit from undergoing chemotherapy or even endocrine therapy using anti-estrogen agents. These therapies given before surgery can shrink a tumor down so that it's smaller and make lumpectomy possible where otherwise the woman might have to go through a full mastectomy. And having medical oncologists who are aware of that interplay between surgery and medical oncology is really important. In another instance, there are actually multiple different types of radiation now. We can do intraoperative radiation. We can do radiation that's really only given for a week but twice a day and requires a catheter be placed. And we can do standard breast radiation, which is typically given basically as an X-ray beam once a day for 6.5 weeks. It takes about 33 treatments. That's the standard, and it's what we measure every other form of radiation by. But it really takes the radiation oncologist and the surgeon working together to see who are the appropriate candidates for those other forms of radiation, because not everybody can have the shorter course of radiation. Not everybody can have intraoperative radiation. But there are patients who might benefit from that, and obviously they get the benefit of a shorter course of therapy. Particularly when you think about intraoperative radiation, the patient goes for their lumpectomy, the radiation catheter is placed in the breast while the patient's still asleep. They zap the breast with the radiation. It can take anywhere from 10 minutes to 30 minutes of extra time. But once that day is done, the patient has completed their surgery and their radiation therapy in one day.